This conference will now be recorded.
Hi, everybody. This is Scott LaFranco. I'm the General Counsel and Vice President of Government Affairs for the Georgia Dental Association. We're going to be covering the legal portion of the GDA's Coronal Polishing course. Thank you for registering for the course and supporting the GDA as we attempt to educate our members and their staff on some of the changes in the law, particularly with respect to the new hygiene supervision rules and laws that went into effect in 2018. This is one component of the hygiene supervision law, the ability of dental assistants to perform coronal polishing. We're going to be covering the policy as well as some of the nuances of the law itself. I hope you understand that the law was drafted in such a way for hygienists to be able to work without the dentist being present. So a lot of what we're going to cover today or during this presentation is really, the nuances of the law as it pertains to hygienists, but it is important for you as assistants to understand the distinctions and the limitations on the law. So that you can properly be a member of the dental team and also advise your dentist if he or she has any questions about the law. Hopefully you'll remember some of the information that we've covered during this presentation so that you can answer any questions or at least be able to direct another staff member or the dentist to the area in the law where this information can be found, or if anything, you can have them contact the GDA office and ask for some assistance on the hygiene supervision law, and those calls usually get directed to me. Please feel free to call the office with any follow-up questions after this presentation. So what we're going to cover today, again, is the coronal polishing component that allows certain qualified dental assistants in Georgia to perform coronal polishing on the primary dentition of patients under the direct supervision of a Georgia licensed dentist. Again, as I mentioned earlier, this was a component of the hygiene supervision law that went into place in 2018, and the Board of Dentistry actually adopted a policy that kind of lays out the requirements for a dental assistant to be able to perform coronal polishing on a patient. So, just one of the things to be aware of is the board actually adopted a formal policy. That's what we're looking at right now. If you go to the Board of Dentistry's website and you look for their policy manual, this will be on page 12 of the policy manual, specifically referencing the law itself refers to quote unquote rubber cup prophy, but the correct clinical term is coronal polishing. So this is what you'll see, and these are the parameters the board adopted for dental assistants. So the applicable code, as you can see, is D1120. It applies to the removal of plaque, calculus, and stains from the tooth structures in the primary and transitional dentition. It is intended to control local irritational factors. One of the things that's in the law is specifically that this is a polishing. Dental assistants can only perform polishing and cannot remove any calculus. Accordingly, the board policy says that if there's calculus, it can only be identified and removed by a Georgia licensed dentist or dental hygienist. One of the things, again, another component of this rule is the issue of what constitutes primary dentition. There was a lengthy discussion when this rule was adopted by the board because of the fact that while the law itself says that it allows coronal polishing to be performed on patients with primary dentition, really the intent was so that children who have pretty extensive coverage under the state's dental Medicaid program will have increased ability to receive preventative services from the members of the dental team. The isolation of primary dentition was necessary to further define that by the Board of Dentistry, because theoretically you could have an adult patient, 50, even a 50, 60-year-old theoretically could have a baby tooth that just never fell out. So the board took it upon itself to define that. And as you can see, it's defined from the ages of 1 to 12. So any patients that are eligible, a dental assistant can perform coronal polishing on a patient from the age of 1 to the age of 12. You cannot perform coronal polishing on patients that are older than that. Once again, the applicable code is a D1120, and the board further defines it, that it's a combined process of the exam, the calculus removal if present, and then the coronal polishing by the trained dental assistant. Does it mean that a hygienist always has to be involved to bill a D1220? No, as you can see, the board policy kind of contemplates that if there's no calculus present, then it could just be the exam by the dentist and then the coronal polishing performed by the trained dental assistant. This last component here sets out the reason why we're here for this presentation, and it's the parameters of the course that a dental assistant must take in order to be eligible to perform coronal polishing under direct supervision. So it says that a dental assistant with at least 1 year of prior chairside experience or a graduate of an approved dental assisting program is eligible to attend an 8-hour pre-approved course of study that includes didactic and clinical applications necessary for coronal polishing and shall include, and as I mentioned, this is the first component, ethics and Georgia jurisprudence related to coronal polishing, identifying the potential risks, indications, and contraindications for coronal polishing, understanding the definition of plaque, types of stain, calculus, and related terminology, dental anatomy and morphology for the proper identification of adult and child dentition, principles of coronal polishing, including but not limited to armamentarium, proper positioning use, ergonomics, preferred polishing technique using a stable fulcrum, abrasive polishing agents commonly used in coronal polishing, polishing coronal surfaces of teeth on a typodont using a slow speed handpiece, indications for professionally applied topical fluoride agent for caries prevention, and the last topic, fluoride delivery methods. So throughout the course of today, you're going to receive instruction on the other components below the ethics and Georgia jurisprudence. As you can see, one of the main requirements is that you have to have at least 1 year of chairside experience or be a graduate of a approved dental assisting program. So hopefully everybody who's sitting there right now watching this video meets that criteria. And we also have a form that we ask that all attendees of this course sign and attest to make sure that they are being truthful and that they meet these minimum requirements to take the course. So there should be a form going about the room for you to fill out and sign. If you have any questions, obviously I'm not going to be there in person, but I encourage you to submit them. You can submit them in writing to me, and I'll be happy to answer them as I get them. It's via email. My email is Scott, SCOTT, @gadental.org. And you can send those to me after the course or, whenever you have an issue that arises in the office. So again, that's this policy right here sets the tone for what we're going to be covering in this portion of the presentation and of the coronal polishing course. Give me a few minutes to. So now we're going to be kind of going over this is the PowerPoint presentation that I'm going to be covering that goes over all of the information that you likely need to know for the coronal polishing law, or for the dental hygiene supervision law. So as I mentioned, the law changed in 2017 and went into effect January 1st of 2018. As of January 1st, 2018, certain qualified Georgia licensed dental hygienists will be allowed to perform specific procedures under general supervision. That means when the dentist isn't present, in private dental offices and in safety net settings. Signed by the governor on May 8th, 2017. So as you all know, prior to the passage of this bill, most of y'all that have been working in dentistry for a while, in Georgia particularly, there was always direct supervision in private dental offices. And right here, this slide reflects the actual definition of direct supervision, just as a refresher. And it means direct supervision as it pertains to procedures delegated to a dental hygienist shall mean that a dentist licensed in Georgia is in the dental office or treatment facility, personally diagnoses the condition to be treated, personally authorizes the procedures, and remains in the dental office um, or treatment facility while the procedures are being performed by the dental hygienist, and before dismissing of the patient, examines the patient. So there's a lot of stuff in there that, I'm sure all of you already know that, the dentist has to be in the office, has to diagnose the condition to be treated, and then has to authorize the procedures and be in the dental office when those procedures are performed. And then before dismissing the patient, there has to be an exam by that dentist. So that's just a refresher of what direct supervision means. And what you may have heard is that Georgia was one of the last states that didn't allow, um, you know, less than direct supervision, and that wasn't true. Prior to 2017, Georgia actually had allowed unsupervised hygiene to be performed in certain settings. One of them is when a dental hygienist is receiving educational training at a institution approved by the Georgia Board of Dentistry and the Commission on Dental Accreditation of the American Dental Association. It didn't apply in public health clinics, county boards of health, or in the Department of Corrections. So that was another key distinction and sort of a correction of some of the incorrect statements that were made prior to the passage of this law that Georgia didn't allow general supervision. No, it was allowed in public health settings and in the Department of Corrections. And then it also doesn't apply if a dental hygienist is doing a screening in settings which include schools, hospitals, and clinics, and state, county, local, and federal public health programs. So that's just kind of a primer on some of the statements that you may have heard or may have been stated before this law passed. So now this is the new definition of general supervision in Georgia law. As I mentioned, Georgia is now allowing certain procedures to be performed by hygienists when the dentist isn't present. So this is the definition. General supervision means that a licensed dentist has authorized the delegable duties of a licensed dental hygienist, but does not require that a licensed dentist be present when such duties are performed. As I mentioned at the beginning of this portion of the presentation, there are two types of settings where general supervision is permitted. And I think probably for most of the folks that are watching this, you guys all work in private dental offices. The law itself, the statute contemplates other settings, and while the term safety net setting isn't expressly used in the statute, we actually, as you'll see, the settings that are defined specifically are what you would typically consider safety net settings. So these are all examples. Title I schools, schools where 65% of the students are eligible for free or reduced lunches, Head Start programs, Georgia's pre-K program, hospitals, nursing homes, long-term care facilities, rural health clinics, FQHCs, health facilities operated by federal, state, county, or local governments, hospices, family violence shelters, and free health clinics. So again, these are the quote unquote safety net settings, even though the statute doesn't even use them. But these are sort of the hygiene functions that can be performed under general supervision in private dental offices. Again, I make this distinction because, as you'll see, there are a little bit different functions that are allowed in private dental offices versus safety net settings, and I'll explain that as well as we move forward. So there's only certain, as you know, dental hygienists can perform any duties that a dental assistant can perform in addition to the delineated duties that the board allows them to perform. However, this law only allows certain hygiene functions to be performed when the dentist isn't present. So one of them is applying sealants, doing a prophy and assessment, fluoride treatment, oral hygiene instruction and education, and then finally the exposure and processing of radiographs if provided by specific standing orders of the authorizing licensed dentist, including any protocols regarding urgent dental issues that may arise. So that's kind of a long-winded way of saying that hygienists can take x-rays without the dentist being present, but only if the dentist has a specific standing order and that order has some protocols about what that hygienist must follow if there's any sort of issue that occurs, or if there's something pressing or a safety issue that takes place. So it's not a blanket, yeah, you can do x-rays. There has to be a written standing order or protocol from the licensed authorizing dentist. Here's some additional requirements for general supervision in private dental offices. A new patient of record must be clinically examined by the authorizing dentist during the initial visit. The patient must be examined by the authorizing dentist at a minimum of 12-month intervals. The patient must be notified in advance of the appointment that she or he will be treated by the licensed dental hygienist under general supervision without the authorizing licensed dentist being present or being examined by the authorized licensed dentist. And the last one, a Georgia licensed dentist may only authorize up to 4 Georgia licensed dental hygienists to work under general supervision. So there's some pretty important information and patient safety protection measures that are incorporated here. For all new patients of record, they have to receive an exam before they can be eligible to receive any hygiene services under general supervision. The authorizing dentist has to perform an exam at a minimum of 12-month intervals. This third point right here, notifying the patient in advance of the appointment, that's another one to advise the patient that they're not going to be seeing a dentist that day, that he or she will be receiving a prophy or some sort of sealant or fluoride treatment without the dentist being present, and it'll be the hygienist performing it. So it gives the patient some notice. And putting my legal hat on, I always advise folks to notify the patient in writing, so that he or she has time to process that information and make a decision as to whether he or she wants to go in without the dentist being present. As you know, it's challenging at times to get patients to make their appointments or to show up at their appointments, if you will, particularly with respect to Medicaid patients. We hear that the no-show rates are quite high. So, a patient may need more than a cleaning. And so if you notify them in advance, and they can, make the proper adjustments to book an appointment where the dentist will be present. Also, the other thing is that there isn't any sort of limitation on how far in advance he or she must be notified. Again, I would just recommend that you notify the patient and give them enough time to process that information. Could it create an issue for your front office staff or for the staff if the patient shows up for their appointment and that's the first time they're advised that the dentist isn't present? That might create some conflict or some tension with the patient, especially if they have another dental issue that they really need to get taken care of. So I would just recommend that, for any hygiene appointments that your office books when the dentist isn't going to be present, you try to give that patient as much notice as possible. The last one, again, is just making sure that you don't create too much of a workload for a dentist to handle, to supervise, and also you don't want to create situations where bad actors could have a whole army of hygienists working without any supervision at all. So it is a 4-to-1 ratio. So example, if there are 2 dentists in the practice, then that would make them eligible to have 8 dentists eligible to work under general supervision. So these are the, as I mentioned again earlier, the hygiene functions that can be performed under general supervision in those safety net settings. It's a little bit different than in the private dental offices. A hygienist can apply sealant, they can do a prophy, an assessment, and fluoride treatment. These are the only 3 functions that can be performed without the dentist being present in a safety net type of setting. One of the main things that you'll notice is that they can't take x-rays in safety net settings. Here's additional requirements for general supervision in safety net settings. This is a big one, and this was another component of patient safety that the GDA incorporated into the law, because of the fact that patients that are often seen in these settings don't have regular dental appointments. They don't go to their dentist on a regular basis. So oftentimes than not, you find patients in these settings that are beyond just receiving a preventative service. They actually need some serious restorative or work to heal an abscess or remove a tooth. So this is actually in the statute, and it says a prior exam in a safety net setting by a dentist is not required. However, a hygienist cannot perform any services under general supervision if the patient complains of dental pain or has clearly visible evidence of widespread dental disease. Such patient shall be immediately referred to the authorizing Georgia licensed dentist for a clinical exam and treatment. The hygienist shall notate the patient's file, and the patient shall not be eligible to receive dental hygiene services under general supervision until a Georgia licensed dentist provides written authorization that such services may be performed on the patient. So again, a lot of legalese and kind of long-winded way of saying that, if the patient sits in the chair in a safety net setting, mind you, if the patient sits in a chair and has dental pain or clearly visible evidence of widespread dental disease, then that patient cannot get a prophy, sealant, or fluoride treatment done without the dentist being present. That patient has to go to a dentist and be examined and treated and cleared by a dentist before that patient can receive any future hygiene services under general supervision. This second component here again is another point of confusion for some dentists who've called the GDA. So if you think about it, this isn't an issue in a private dental office, but this could be an issue because a dentist in the safety net settings, because the dentist is actually sending out their hygienists to a remote location, not within the dental practice. And so to protect patient safety, you want to make sure that the supervising dentist or authorizing dentist is located within relative proximity to the safety net setting in question to address any immediate issues relating to care, or if there's some sort of dental emergency that must be taken care of immediately, that dentist can get there within a fairly quick time. So again, in safety net settings only, the authorizing Georgia licensed dentist shall practice dentistry and treat patients in a physical and operational dental office located in Georgia within 50 miles of the setting in which Georgia licensed dental hygienists are performing hygiene services under general supervision. So, you want, and the 50-mile radius may seem a little arbitrary, but it's really related to the state's Medicaid contract and what they have to provide. They have to have a provider within certain mileage distances of specific types of areas. So for example, in urban areas, they have to have a provider, I believe, within 30 to 40 miles. And then in a rural area, they have to have a provider within 45 miles. It's either 40 or 45 miles. But again, the 50 miles is sort of the compromise on that language. The other component, as you'll see, is you actually have to have a physical and operational dental practice. You can't just have, just an office where you're not treating patients. The dentist has to be an operational practice where they treat patients in an office setting, which has to be located within 50 miles of the safety net setting. So for example, you don't want to create situations where you have a Georgia licensed dentist in Nashville, Tennessee, and you have who has 4 dental hygienists working under general supervision in Valdosta, Georgia. That's not safe. That wasn't what our association felt was a safe standard of care for low income and underserved patient populations. The other thing is it has to be located in the state of Georgia. So, for example, if you're in, and I'm just making this up because I'm not sure what the actual mileage uh, is, distances between Valdosta and Jacksonville, but you also couldn't have a Georgia licensed dentist in Jacksonville sending her hygienist over the state line to Valdosta or somewhere close to the state line that's less than 50 miles. The dental practice must be located in the state of Georgia. The last component is that for any dental hygiene services performed by Georgia licensed dental hygienists in mobile dental vans, they always have to be provided under general supervision. So if it's a mobile unit, the dentist always has to be there. It can't just be a mobile unit with dental hygienists riding in it. There are, similar to the private offices, there are additional requirements and safety net settings. Similar to private office, there has to be a written notice provided to the patient. Since they potentially could never see the dentist, the patient has to be provided the name and license number of the Georgia licensed dental hygienist and authorizing Georgia dentist. There has to be a statement indicating any hygiene issues that the hygienist identified. If the patient is ineligible to receive hygiene services under general supervision due to that exception of dental pain or clearly visible evidence of widespread dental disease, the written notice shall also contain a statement that the patient is not eligible, they cannot receive hygiene services until she or he receives a clinical exam by a Georgia licensed dentist and the dentist approves written authorization allowing for hygiene services to be performed under general supervision. And for those patients that are eligible to receive general supervision hygiene services, there has to be a statement advising them to seek a more thorough clinical examination by a dentist within 90 days, unless that patient has received an exam by a Georgia licensed dentist. So again, these are the safety things for patients, the written notice, providing the name and license number, any hygiene issues, and then an explanation why they're ineligible to receive hygiene services under general supervision and advising them that they have to go to a dentist and get an exam. This next slide reflects all of the requirements, the minimum requirements for Georgia licensed dental hygienists to work under general supervision. And as the slide says, it applies whether this is in private dental offices and in safety net settings. So any licensed dental hygienist working under general supervision is required to possess at least 2 years of experience in the practice of dental hygiene, must be in compliance with CE and CPR requirements, must be licensed and in good standing with the Georgia Board of Dentistry, and must maintain professional liability insurance in accordance with Georgia Board of Dentistry rules and regulations. And the board actually set a minimum policy limit of $1 million per occurrence. So this is sort of a new requirement. If the hygienists are going to work without the dentist being present, they have to carry their own liability insurance. The first point about having 2 years of experience in the practice of dental hygiene, the Georgia Board of Dentistry is currently, as of the time of this recording, is currently adopting a new rule to kind of further define what it means to have experience in the practice of dental hygiene. But right now, it hasn't been adopted. It's not formally adopted or passed. So really all it contemplates is what the statute says, is that the hygienist has to have at least 2 years of experience in the practice of dental hygiene. This is the component of the law that I mentioned that gets to the dental assistants in the office. This is the actual language from the statute. It says qualified dental assistants may use rubber cup prophy on a patient with primary dentition under direct supervision of a Georgia licensed dentist in accordance with any guidelines or rules established by the board. Dental assistants shall meet any education, training, or other requirements as established by the board. So that policy that we saw when we first started the presentation is exactly what was formulated in response to this requirement by the Georgia General Assembly regarding the training and education requirements established by the board. Again, the law itself uses rubber cup prophy, but the Board of Dentistry has instead preferred to use the term coronal polishing. Finally, this is a really key component because I think there may be some confusion, but general supervision is a tool, for dentists to use if they so choose. But ultimately, the dentist is the head of the dental team and has control over what procedures are performed or not performed in the office and who's can perform them while he or she is not present. So it's in the statute that general supervision is allowed, but it's not required. So these three things, the three statements that you see in front of you are actually in the law itself, and it says no Georgia licensed dentist shall be required to authorize Georgia licensed dental hygienists to perform dental hygiene services under general supervision in private dental offices or in safety net settings. It shall be the sole discretion of the authorizing Georgia licensed dentist whether to require an initial exam of the patient prior to the performance of dental hygiene services under general supervision by a Georgia licensed dentist. And that's as it pertains to the safety net settings, because as you recall, in private dental offices, a prior exam is always required on all new patients of record, whereas in the safety net settings, an exam is not always, prior exam is not required. And then finally, this is another key component of the law. None of the aforementioned provisions shall be construed to establish independent dental hygiene practice. The Board of Dentistry has created rules, and this slide is sort of a summary of the policy that I showed you earlier. The applicable code for this is a D1120. Again, calculus, if present, can only be identified and removed by a Georgia licensed dentist or hygienist. The age of primary dentition for coronal polishing, as it applies to this coronal polishing rule, is the ages of 1 to 12. And again, the D1120 includes the combined processes of examination. This is another component of that policy. You must have 1 year of chairside, prior chairside experience, or be a graduate of an approved dental assisting program, and then you must attend an additional 8-hour pre-approved course that includes didactic and clinical applications necessary for coronal polishing, which is what you're doing right now. In May of 2018, the board issued some additional guidance and limitations on the hygiene supervision rule. So a D4910, code D4910, which is, I think, usually referred to as periodontal maintenance, cannot be performed under general supervision. Second, silver diamide fluoride, it can be applied by hygienists under general supervision for preventative purposes only, but not therapeutic. So in that definition of the application of fluoride, which can be done in private dental offices and in safety net settings under general supervision, silver diamide fluoride can be applied under general supervision. That's sort of the end of the presentation on the overview of the summary of the hygiene supervision law. So now I'm going to cover just some sort of what I like to call some scenarios that you may come across in the practices, and some things that you may see. Hopefully it'll be, after listening to this presentation, you can follow along with me, and we can kind of walk through these hypotheticals, and you'll be able to answer them based on the information that's already been presented. So the first scenario: Josh just moved to Georgia, and his aunt, who is a dentist, offered him a job working as a dental assistant in her office. Josh has no prior dental experience. His aunt just opened her office and is excited that Georgia passed a general supervision law because she likes to work out in the morning and is sometimes late to the office. However, to make up for her tardiness, she wants to train Josh to take x-rays on patients before she arrives. Josh has some reservations about this because he just took the GDA's course on coronal polishing. However, before he says no to his aunt, he wants to be 100% sure he can do this. He also knows that his aunt will not believe him unless he's able to show her the applicable board rule. So, first question, does Georgia law allow dental assistants to take x-rays? And yes, it does. Uh, dental assistants are allowed to take x-rays as long as they've received the requisite training. You can find the rule on the Board of Dentistry website, but if you look at this this rule right here, it says right there, B, under the functions of a general duties dental assistant, they can place and expose radiographs after completing the training required by Georgia Comp rules and regulations titled X-rays and the Healing Arts. So as long as he's received the proper training, dental assistants can take X-rays. Can dental assistants take X-rays without the dentist being present? I hope it was clear during the presentation, the PowerPoint presentation of the hygiene supervision law, that X-rays can only be taken by dental assistants under direct supervision. None of the general supervision rules apply, even under corona polishing. Corona polishing must be done when the dentist is present. Only hygienists, Georgia licensed dental hygienists, can take X-rays without the dentist present. Josh's aunt also wants him to perform a rubber cup prophy / corona polishing. What are the limitations on dental assistants performing this procedure? Is there a board produced document containing these limitations he can show to her? And we've talked about it, but yes, it's this board policy that we started the presentation with, lays out all the requirements that a dental assistant must meet in order for he or she to do corona polishing. It is, again, limited to patients from the age of 1 to 12. And calculus, if identified and present, can only be removed and identified by a Georgia licensed dentist or dental hygienist. And he also has to take, of course, the 8-hour pre-approved course. In Josh's particular situation, since he just started, he's actually ineligible to take, since he has no prior dental experience, hasn't graduated from any assistant program. He would actually have to wait a year in order to be able to perform a rubber cup prophy or coronal polishing. So again, that's all laid out right here in this board policy. All right, let's move to the second scenario. You've been hired by a dentist who just moved to Georgia after practicing for many years in New Mexico. The dentist is very skilled, but you can sense that he is a little shaky when it comes to the supervision rules for hygienists in Georgia. He wants to take advantage of the new law and plans on sending his dental hygienists and dental assistants to schools, nursing homes, and hospitals to provide care. To provide care for low-income patients while he treats other patients in his office. He has assembled the following list of questions and has asked you to put together a summary of the applicable rules, including where he can locate these rules for him. So, can both dental hygienists and dental assistants work under general supervision? No. As we've previously stated, only Georgia licensed dental hygienists can work when the dentist is present. All functions performed by Georgia dental assistants have to be done under the direct supervision of a Georgia licensed dentist. B, are they allowed to work under general supervision in the aforementioned settings? If so, are there any limitations on these settings? They are allowed to, dental hygienists are allowed to work under general supervision in schools, nursing homes, and hospitals. But as y'all may recall, it's only certain types of schools. Right here, as you can see, Title I schools where 65% of the students are eligible for free or reduced lunches. So there are limitations on where the hygienists that leave the office can go to do these hygiene functions under general supervision. Are there limitations on these settings? Again, I would just kind of remind everybody about the these requirements, as well as the notice that has to be sent. Let me see. Yeah, the notice that has to be sent to the patient in the safety net settings. Does the new supervision law limit the number of dental auxiliaries that can work under general supervision? Yes, as we also covered previously, it's a 4-to-1 ratio for dental hygienists to dentists, authorizing dentists under general supervision. There is no limit for for the number of dental hygienists working under direct supervision in a dental practice. So it's not limited to 4-to-1. That's only for general supervision in private dental offices and in safety net settings. There's no limitation for dental assistants that work under direct supervision. So that's the answer to C. D, if the dentist's office is located in Blue Ridge, Georgia, can he send his dental auxiliaries to Valdosta to work in these settings under general supervision? No. Again, no dental assistants can be sent outside the office, but if the dentist chooses to send Georgia licensed dental hygienist, that's where that 50-mile, this rule right here, the 50-mile limitation applies. That has to be 50 miles, and Valdosta is not 50 miles from Blue Ridge, Georgia. E, is he always required to perform an exam before patients can receive treatment under general supervision in schools, nursing homes, or hospitals? No. Again, that's the main distinction between private dental offices and in safety net settings, is that a prior exam is not required. However, the dentist could still require, if the dentist feels that's the safest way to allow these hygiene functions to be performed when he or she isn't present, then the dentist can always perform an exam first and then send the hygienists out later. Second part of this question, are there any instances where an exam is required? Yes, as you also may recall, this was the part of the statute says that hygiene services under general supervision can't be performed if the patient has dental pain or clearly visible evidence of widespread dental disease. F, in schools, nursing homes, and hospitals, can x-rays be taken if the dentist is not present? No. Once again, that is one of the key distinctions between what can be performed in a private dental office versus what can be performed in a safety net setting. In private dental offices, the hygienist can take x-rays without the dentist being present, but in the safety net settings, no x-rays can be taken without the dentist present. Finally, paragraph G, he is thinking about purchasing a mobile dental van to make it easier for his staff who are out in the field. And sorry for that typo. Can they perform any procedures without him being present? No. The law, again, states that any hygiene services performed out of mobile dental vans shall always be under direct supervision, that there has to be a dentist present. So right there. All right, this is the last scenario. So, I hear common complaints between, dentists and aggressive staff. So I'm sure some of you have had a similar experience in your work history or your careers in the dental field. So this is kind of a play on that dynamic. The private dental office where you've been employed, for several years just hired a new dental hygienist named Rick. Although he has only been in the office for a few weeks, you and the other members of staff have noticed that Rick tends to be standoffish when it comes to the procedures he can perform when the dentist is not in the office. In fact, he's yelled at another staff member when she questioned him trying to perform a procedure when the dentist was on her lunch break. While others find Rick difficult to deal with, the two of you actually get along quite well, so you're confident that he will listen to you if you sit down with him and explain the nuances of Georgia's hygiene supervision law. So the first sub question is, Rick insists that the hygiene supervision law requires the dentist to allow him to perform prophies when the dentist is not present. However, you know from working at the practice that the dentist has a written policy stating that no procedures will be performed in the office without her being present. Is Rick correct? The answer is no, Rick is not correct. As you may recall from that last slide that we looked at, general supervision is allowed, but it's not required. So it's ultimately the decision of the authorizing licensed dentist whether to allow general supervision and to allow any procedures, particularly these specific dental hygiene procedures, to be performed without the dentist being present. Okay, so B. Rick is Rick is also very adamant that the new supervision law allows him to perform any procedures that can be performed by a general duties and expanded duties dental assistant without the dentist being present in the office. After taking the GDA's approved course on this issue, you know exactly which procedures he's allowed to perform under general supervision in private dental offices. What procedures may be performed in private dental offices under general supervision? Where can you find the list? So again, it's in the statute, but if you want the shortcut, here it is again. They can only perform specific functions. It's not wide open. They can do Georgia licensed dental hygienist working in a private dental office may only apply sealants, oral prophylaxis and assessment, fluoride treatments, oral hygiene instruction and education, and then can take x-rays again, but only if there's a standing order by the authorizing dentist, and that standing order has to include some written protocols for the hygienist to use if there are any dental issues that arise or if there's some sort of dental emergency that takes place. C, after reviewing the general supervision rules, your dentist has decided to allow Rick to work under general supervision. However, she wants to be clear that Rick meets all of the requirements. What are the minimum requirements all dental hygienists working under general supervision must meet in the state of Georgia? So again, that's covered on this slide that we saw earlier. Any licensed dental hygienist working under general supervision shall have at least 2 years of experience, must be in compliance with CE and CPR requirements, must be licensed and in good standing with the Georgia Board of Dentistry, and most importantly, and this is a new requirement that's in the law, is that the hygienist has to maintain professional liability insurance. And as I mentioned, the board implemented $1 million minimum policy limit per occurrence. The dentist calls the GDA and finds out that Rick needs to have liability coverage in order to work in the practice under general supervision. Does the Board of Dentistry require any minimum policy limits? Yes, we've covered that $1 million. Is the dentist required to pay for Rick's malpractice coverage? So I want you to think about that. No. The actual answer is no. The dentist is not required to pay for Rick's malpractice coverage. Now, I only bring up that nuance because, when the bill went through, we got a lot of questions, and so we had to throw it back to our malpractice carrier that we have a relationship at the GDA, and we were told that some malpractice carriers don't issue separate hygienist policies. So, you just want to make sure, you want your dentist to check and make sure that if he or she is going to allow the hygienists in the practice to work under general supervision, that the dentist's master policy or whatever the dentist liability coverage policy is, it will extend to instances where hygienists are working without the dentist being present. MedPro, which is the GDA's endorsed partner for malpractice coverage for dentists in Georgia, actually issues a separate policy that has to be purchased. It's a very inexpensive policy. I believe it's less than $100 per year. So I would just make sure that your dentist or whoever manages your office checks with your malpractice carrier if it's not MedPro to make sure that proper coverage is in place, because again, the board requires the law requires coverage to be in place, and then the Board of Dentistry actually imposed a minimum policy limit of $1 million. So just make sure that those stipulations are met if your dentist wants to allow general supervision in the practice. Again, that's pretty much everything that we're going to be covering on the ethics in Georgia jurisprudence. I hope all of you got a lot out of this, and even if you don't remember all of the information, you at least can say that you've heard it before or seen it before. And if there are questions or you have more questions and need more details about specific situations, again, please don't hesitate to call the GDA office or email me at the office. And my email address is scott@gadental.org, scott@gadental.org. Thank you for your attention today, and please let me know. Hope you enjoy the rest of the day when you learn about coronal polishing. Thank you.